Hey, good people. I wanted to go ahead and re-record my unboxing of the breathing Inspiratory Muscle Trainers. Reason being, because I had the camera flipped the wrong way, and I'd like to make a better video for you. So we're going to pretend that these have never been opened. Now, what I wanted to start with, the information from this paper that recently appeared in the American Journal of Medicine. Author is Dr. Richard Severin. He is also a physical therapist. And I wanted to share some numbers with you. Or some information with you. Okay, so when the authors talk about respiratory muscle training, it's referring to muscle strength, exercise capacity, diaphragm muscle thickness, and shortness of breath in several patient populations. So what they're looking at are people in poor health, at risk for viral infections, who may demonstrate muscle weakness of their diaphragm and could be at more risk for that dangerous acute respiratory distress syndrome that we see with COVID. All right, and when they're talking about training the diaphragm, their protocol is 30 breaths 2 times a day. So we're talking 30 inhales under resistance twice a day. Some protocols last only 4 weeks. And so people who are short of breath, are sedentary, they're going to show the quickest benefit and the most benefit. So I wanted to share that as we re-unbox these different inspiratory muscle trainers. All right, I gotta set these bad boys down. All right, this is the most basic one by Philips. It's called a Threshold IMT. Comes with a nose plug, so you can focus on your trachea. Okay, and then I've already put this together. Comes with a valve piece and a little screw inside that adjusts the resistance. That you can see where the resistance is by the red tab. All right, so let's see what this looks like at lowest resistance. So I'm going to breathe it here, and when this reaches the lowest level of resistance, which they measure this in centimeters per H2O, just their unit of measurement. When we reach 9, that's kind of funny to say with the nose clips on, 9, this valve's going to open. And you should kind of hear a pop. So hopefully you could hear that little pop. Now I'm going to crank it up to midway, right around 27. Produces a lot more resistance. And you can see I have to keep my shoulders relaxed. Otherwise, I'm going to be using muscles other than my diaphragm and my rib cage to breathe in. And then all the way to the tippy top, 41. That is really hard, and I felt like I was breathing more with my trapezius than with my diaphragm. We'll set this guy aside. That's number one. And that cost me 25 bucks for a bare bones model. All right, this guy that I love because it reminds me of the movie 2001, The Spaceship. This one's almost as if someone put it back on the shelf. All right. So we have two mouthpieces. Not going to worry about this one. And then for this guy, so removable mouthpiece, like the other one. This one has dials on either side. One is inhale, one is exhale. We're not going to worry about training the exhale because that's referring to people with other types of coronary or respiratory conditions that we're not going to worry about right now. We're going to worry about the inhale. So this dial goes from 1 to 6. All right. So we'll go to 1. So you can, I think I would have to dig into the manual to tell you how much pressure that is. Okay, so let's do this. That's easiest, and we'll just go to most difficult. That was difficult, not as difficult as the Philips model, but as you can see, we don't have as many choices for how much resistance we want to put on to do our training. This cost me 40 bucks, okay? So a little less flexible, a little prettier, just kind of made for consumers. All right, and then this guy right here. Now with, see? Box came right off. All right. So with this breathing trainer, this is focusing more on sports endurance training and also to be able to perform at altitude. So we're going to set this aside. This was actually the least expensive option, 20 bucks. And then your resistance is basically just like turning on a hose, righty-tighty, lefty-loosey. Okay, so we're going to open this all the way. It's got a big old mouthpiece here, I think made for boys. So initial setting is more difficult. than either of the other two. And the thing that I was focused on this whole time is this giant mouthpiece sitting in my mouth, and I'm thinking about, and they want me to work out with it. Okay. And then we'll turn it all the way so the resistance is all the way up. And it's all the way closed. Okay, let's try that. Okay, the hardest setting. Imagine if you're trying to breathe through, remember those little teeny tiny coffee stirrer straws? You don't really see them anymore, but you kind of get that feeling. Hardly any air, lots of resistance. I'm not sure how it would be a viable option, but if you're looking at your sports performance, I think this is, you would see this around. As far as, you know, for an elderly person, not sure I would use this, but I just wanted to show you what options are being advertised when you go look for inspiratory muscle training. All right, and yeah, I think I mentioned $20. $20 will do it for you. Okay, those are the Inspiratory Muscle Trainers. As I mentioned before, from this research paper, suggested protocol is 30 in-breaths twice a day. And as always, if you're interested in this, talk to your physician, talk to your physical therapist. We are trained in, our education and training is in training your muscles to get stronger so you can be healthier, because we're all about prevention and wellness, okay? So none of this is medical advice. I just wanted to show you how these things worked. If I'm feeling up to it, I'll try this guy on my bike with my trainer. What I'm doing is Zwift ride. We'll see about that, see how I'm feeling.